Hi friends, this is Jasmine. So we are in a channel of Crack the Nursing Licensure Examination. So till now I have uploaded like 2-3 videos regarding the examination, how to appear with examinations which has been conducted for NCLEX, HAAD and DHA, even MOH also. So regarding with this examination question answers, we have been discussing with the test plan and with the test taking strategies with these previous classes. So in the previous class, in the fourth video, I was been discussing with the test taking strategies. So a few strategies I have been discussed like pyramid point, ingredient of question, strategic words, subject of the question, positive and negative event query. So in this video, I am going to continue with those strategies. So few more strategies we are going to discuss. So like these are all the strategies we have been discussed already with the strategic. If you want to know regarding this, please go into the previous video which I have been uploaded in this channel. So the next strategies, that is like a using of ABCs, airway, breathing and circulation. So based upon this also they can ask you. So one of the example, the client with the diagnosis of cancer has been receiving morphine sulfate for the pain. So the nurses should employ which priority action in the care of this patient. So already the patient has been undergoing a cancer. He is already having a diagnosis of cancer. He's been undergoing a treatment with the morphine sulfate also for the pain management. What would be the which priority action you will be taking here whenever you are been administering with this medication? Whether you will monitor the stools or encourage the fluid intake, or whether you will monitor the urine output, or whether you will encourage the client to cough and deep breath. We have to think of the drug. Here the drug which has been given here for pain control is the morphine. That is one of the opioid analgesics type. So you must know regarding the opioid analgesics what it would be happening whenever you are taking the opioid analgesics. So whenever you are taking the opioid analgesics, so the fourth option is the correct answer. That means we need to encourage the cough and deep breath. Because why we have to do this means when we are taking the opioid analgesics, not only with the morphine, any other type of opioid also, it will be acting as an analgesics, but at the same time it will be decreases the preload and afterload, and even that will be decreases the venous return also. Even the euphoria feeling also they will be having. Mainly the two system will be getting affected. That means the respiratory system will be getting into the depression state, and even the central nervous system also will be getting into the depressed state. So that's why we are getting more complicated. If it has been like overdose happens, usually the condition will be like more complicated. So whenever we are been administering the morphine sulfate, we have to be very careful in its administration methods, even with the dosages also. So immediately whenever you are administering it, within 1 or 2 minutes you will be getting into the onset of action. It will be which will be acting faster. But the duration of each doses will be taking up to 2 to 7 hours the function, and with the duration of its action will be long lasted till 7 hours also. So as an indication, this will be mainly with some of the chest pain, even with the major like a chronic pain conditions. Here, as we have discussed already with this question, this is also like a cancerous condition. So here also the pain will be like more chronic type. Like that pain will be like more chronic, and that will be looking like more annoying for them. Continuously they will be getting into the pain more. So here also we will be needed a opioid analgesics. So that's why this will be the best choice of analgesics to be given here. So the main important priority whenever we are been administering the opioid, we have to concentrate on this respiratory and with the central nervous system. So the appropriate option that has been related to these things is that we need to encourage the client to cough and deep breath. Only then we can encourage them to have the proper maintenance of their respiratory system. If the respiratory system get into the depression, that will be becoming a problematic for the patient. So we have to prevent this. So we need to often during the treatment time, we need to encourage them to cough and deep breathing. Those exercises we need to promote here for the patients to manage the conditions. Next strategy is the Maslow's hierarchy model. That means Maslow's hierarchy of needs. We have already discussed this also regarding this model. So one of the example based upon this hierarchy needs, that means priority needs. So what does that means? One of the example, let's see the example so you can understand it very well. The nurse is caring for the client experiencing a dystocia. You have been determining the priority, which action you will be taking here, that's been asked. So whether you will be position changing will be the important, or by providing comfort measures, or by explanation to the family members about what is happening to the client, or monitoring for the changes in the physical condition of the mother and fetus, and reinforcement of breathing techniques learned in childbirth preparatory classes. So you must know what is the meaning of dystocia. You may be heard this previously. One of the specialty like maternity with the labor time. So if there is any problem happens with the labor, something like stuck up and something like improper labor, something like problem happens in the labor pain also, like uterine contraction is not like properly happens, means the dystocia happens, like shoulder dystocia you may be here. So in this condition, which will be the priority things you have to determine here? So the correct answer would be the C. That is the mean monitoring both the changes which has been happening in the physical conditions of mother and fetus together, we need to check for them. So that is the priority thing, because the both the life we have to save the life of the both the people, like both mother and the fetus together, we have to take care of them. That is the most priority thing you have to take care, because this is one of the life threatening condition. Because if it is been becoming serious, both the mother also will be getting into the dangerous, and even baby also will be getting into the dangerous condition if this is not treated well immediately. So we have to go into this management properly to both the ways. In the both the persons we have to concentrate in their physical changes. As I have told you already regarding the Maslow's hierarchy needs, what it mean. So that means it will be showing the basic needs, psychosocial needs, and self-fulfillment needs. So we will be concentrating here. First priority always you have to go with the physical needs only. That means physiological needs like air, water, and with the warmth and rest, and even with the airway, breathing, circulation, everything will be comes under the physiological needs. So we must always keep this in your mind. Like whenever you have been answering any questions, we have to keep this in your mind. Next things is the nursing process. We are going to see with the nursing process each and every steps here. So from here I will be taking in the next class. From here I will be going to take a video. In the next video I will be discussing from the assessment. That means the nursing process usually will be having assessment and the diagnosis, and how to make a plan according to that compliance, and with the interventions how you will be making that planning into the intervention processes, and how you will be evaluating those therapies and effectiveness of the therapies. So these are all the steps we are going to discuss in the next class. So please go through the remaining videos also. It will be very helpful for you to go through with your nursing licensure exams to crack well, to get pass out of those examinations. So all the best for your examination. See you in the next week. Subscribe to my channel, like my channel. Thank you.